Be quiet, guys. Shh, my bad. I got dogs, so if they start barking, I apologize.
I got cats. They're meowing too.
Yeah, I don't. Maybe the cats are a little bit louder than dogs. Not just kidding.
I don't know.
But so we went into the off season thinking like, okay, like we're gonna make a run for 2022. Given the fact that we got third, we got second, we have some Olympia points. There were some tough lineups. In April, I tore my meniscus. So that kind of set me back. Jared, what you were saying about your quad. I encourage you to check out, because I didn't go to TB route or the BPC. I ended up using class 4 laser treatment from my local chiro. It's actually like this infrared laser. It's non-invasive. And it's a little bit pricey, but they localize it to the area, and think of it as you probably heard of PRP. Yeah, be quiet. Probably heard of PRP before. And it's similar to PRP, where it's shoving a lot of blood and nutrients, but it's making your body kind of shove them to that area. So I did 6 treatments of that, and I shit you not, I think it completely fixed my meniscus, honestly. So I had to take a month and a half off, a month off legs, maybe a little bit more, because I didn't want to go down the surgery option. And as soon as my knee started to feel better, I strained my pec. So I got an MRI on that. It didn't come back as it was torn. It was pretty good strain. So I had to take, a month off for chest training. So I was off and on for 2.5 months with my training. I didn't go too far south in that time period, just because I was still dieting and whatnot and trying to do cardio. But I view that as a time where I'm okay, I'm just gonna let myself rest a little bit. I'm not gonna push the training too hard. I'm feeling better, thankfully, but it's not, we're not going to really make a run this year. It's not worth it, to be honest with you. I wasn't able to grow properly. Right now, I've gotten to the biggest point I have been, size wise, with the lines I do, but we just don't see it fit to go into a rushed prep for a show that's probably you guys mentioned some shows last minute, probably 18, 16, 17 weeks out. Just I'd have to start prep now. It just doesn't make sense for us. We'd rather kind of rest up and maybe do something next year, early next year. So that'll be Boston, you guys kind of did some earlier shows this year. That's the plan. I've never done early shows in the year. I've always kind of waited till summer and fall. So I'm okay, maybe the switch up will be good, so yeah, that's kind of where we're at right now with what's going
on. Okay, Justin, I really appreciate you talking about laser, man, because my chiropractor actually pulled me aside when I was at the gym the other day, and he was like, "Yeah, I want to get you started with the laser this week." So I was actually talking to him on Monday, but man, I didn't know anything about it until you explained that.
Yeah, so class 4 laser. Well, listen, they have a bunch of different classes for it. Class 4 is just the most updated version. How they have version 1, version 2, version 3, right? So this is class 4. So I guess class 1 was the very first of its kind, and then they've progressed up. So yeah, I like I said, I saw a local chiro to me. It was recommended from a friend who's a chiro who doesn't live around me. He's yo, I really want you to find a chiro near you that does this laser treatment. I truly believe it's going to help you. And he's got nothing to benefit off of sending me to a chiro near me. You know what I mean? To get the lasers. Not he's trying to, the money ain't going to him, right? You know what I mean? So he's I really think this is going to help you. And yeah, I had 6 treatments, and they're 15 minutes long. And I genuinely think that I have no knee pain in that knee now. And I tore it, it was bad. I couldn't walk. It was swollen shit for for a couple weeks. It was very uncomfortable, extremely uncomfortable, sharp pain every step I would take. And once I started doing this, I literally after the first session, I had a little bit of relief. But then after the second and third session, I'm oh wow, I'm starting to feel really good. And then by the 6th session, I was this is really good. And 6 is what he recommended. I'm not sure what your guy will recommend to you. I mean, if you have access to doing it for a pretty reasonable price, it might be worth it to kind of do it a little bit more often. But just think about it too. If you have a muscular strain or a muscular tear or whatever you kind of mentioned, it's more inclined to heal quicker than like a meniscus tear or a tendon tear, something where like blood flow to the area is a bit tougher, right? So like you might only need 3-4, and you've been rehabbing it yourself, you said, with the TB, and it feels a little bit better. But I do think you should look into the laser. I think it's super like beneficial, honestly. Yeah, really.
Man, I really appreciate that. Yeah, I'm gonna talk to him on Monday about that, because he didn't even like explain it. He was just like, you have to come and do it. But like I said, hearing you explain it like pretty thoroughly, like it just makes me, I feel pretty good going into there. You know what I'm saying?
At the time, you're probably like, oh, you're just trying to like, sell me on.
I mean, he's like a good guy, so like I knew it was good, but like I had no idea, how good it was.
Yeah, until you hear from another competitor who's had a similar like injury or issue, and like you can kind of reconfirm what he's saying. You know what I mean? Because at first I'm like, the fuck is this little
what's it gonna do?
red laser? It looks like a microphone they're putting on your body, and they're going back and red laser. What's this gonna do? But I don't know. It worked pretty well, So
that's what's up, man.
Yeah, you gotta try that.
Did it hurt at all, or was it like did you feel it?
You don't feel it. It feels a little warm because it's a laser. So, but it's non-invasive. Like I said, it's not like a laser like you touched the stovetop where it's that hot. Like it's not uncomfortable. It's fine. I don't know what the science is. I don't know. So I'm not going to even talk like I'm, like I know what exactly the science is, but they explained it a little bit, and how like really it like gets the area, and think of it the same way as like a cryo, where like you hop into that chamber, or if it's a cryo, I always say cryo, if it's a cryo gun, what they're doing is they're inflaming that area, so blood like kind of goes away from it, and when it goes away, everything just shoots back into the area. You know what I mean? Like it shoots back into the area, and essentially, like I think BPC and TB are kind of, from what I understand about those peptides, trying to allow your body and like I remember looking it up because I was gonna do it, like I said, and then this was recommended. I'm like, fuck it, I'll give it a shot, right? You know what I mean? I'll just go to this Cairo. But essentially, this thing is like driving nutrients, and that's why I mentioned PRP. PRP injections, plasma-rich platelet injections. So it's a similar concept, just non-invasive, where like the PRP, they'll inject it into the area, and it'll drive the blood there. This is just like, it just drives the blood there. I don't know the science behind it, so I'm not even gonna act smart, but it very much so helped me. You know what I mean? Seriously.
Is it this, like, which one of these weird devices are we talking about here?
So wait, go down with the thing. Wait, no, don't scroll. Yeah, like anything of those that look like a flashlight.
Okay. And they just put it on the skin. And
yeah, but this doesn't really do it justice because it's hooked up to a big machine. It looks a lot more comprehensive than it is. Okay. You see,
type in like red light therapy laser.
Type in class 4. Class 4. Class 4. Okay. Yeah. So that box looking thing, that like any one of those really, it's like that. Like look, go on. Yeah, right there. Yep, the one you're about to click on. Like that is kind of what it looks like. Yep.
Okay.
Yeah, that's exactly it.
Wow.
I know.
Yeah. Looks a little bit more official than the flashlight.
Yeah. Well, apparently you can buy some knockoffs, but I don't think they really do.
Yeah, I don't know. Knockoffs are called knockoffs for a reason,
This thing was like, like $15K apparently. The Cairo was the pricey equipment, but it really, really helps. So like,
yeah,
I can attest to that. You know what I mean?
Okay.
So yeah, when I heard you talking about your quad issue, I was going to bring that up, but I was like, I'll just bring it up after when I bring up the meniscus thing,
Mm-hmm.
Yeah, no, like I really, really appreciate that. Like, yeah, very thoroughly.
Help you. Yeah, for sure. No doubt about that. Yeah.
Okay. Alrighty, ladies and gentlemen, that was the highlight reel. Please subscribe, like the video, and let me know what you guys want to see on the next podcast. I'm Saunch, your host. Thank you so much for watching. Like, comment, subscribe, and I'll see you in the next one.